Breast implant illness is a super hot topic in plastic surgery today. Is breast implant illness real? Are people suffering from it, and are breast implants even safe? So today I'm going to go over with you the research regarding breast implant illness, both the pros and the cons. I'll go over my experience with it and what I'm recommending to my patients today. My name is Dr. Anthony YOUN. I'm America's holistic plastic surgeon, and I'm in private practice in Metro Detroit. So what is breast implant illness? Well, breast implant illness is a constellation of symptoms that some women appear to develop after undergoing breast augmentation using silicone gel implants, silicone implants. And these are symptoms that you're seeing here, symptoms like fatigue, muscle and joint pain, brain fog, rashes, hair loss, and even fevers. Usually these types of symptoms don't appear right away. They can take several years before people start to experience it. So why is this such a big issue right now? Well, the silicone breast implants were actually banned by the FDA back in 1996. And they were banned for many, many years, up until 2007, when they were put back on the market because they were deemed safe. And this belief that breast implants, silicone breast implants, were making women sick were disproven by studies. Well, in the last couple years, there have been a lot of groups coming forward, groups of women who believe that they are having symptoms due to their silicone breast implants. And they're on Facebook groups. There are a couple of websites, breastimplantillness.com and healingbreastimplantillness.com, that have gotten tens of thousands of women telling their stories. So unfortunately, though, there's this disconnect between plastic surgeons and patients that has developed. There are plastic surgeons who strongly believe that breast implant illness just is not real, that these symptoms are due to other issues, and sometimes they even blame it on psychological issues. Well, this is opposed to patients. These patients, tens of thousands of women who believe that they have sickness due to their silicone breast implants, and quite often they come to plastic surgeons' offices requesting very invasive operations to remove their implants and the scar tissue that surrounds them. Well, there are numerous studies that appear to show no link between silicone breast implants and these types of symptoms, the symptoms of breast implant illness. And these are some of the studies that have been the basis of the FDA lifting that moratorium back in 2006, 2007. Now in 1998, Sweden, there was a study, 10,000 women, no association that they found between connective tissue diseases and breast implants. In 2001, there was a study in Denmark, 11,000 women, no difference in rates of rheumatic conditions, and women with silicone breast implants. There was a 2003 study from Denmark, 238 women. They also found no connection between silicone breast implants and connective tissue diseases. And the big ones here in the United States are the FDA core and post-approval studies. There's a study of Mentor memory gel implants, 1,000 women, 64% follow-up at 7 years, no evidence of a connection between silicone breast implants and connective tissue diseases, and a 97.6% satisfaction rate with their breast implants at 10 years. Natrel, the other big breast implant manufacturer in the United States, they had 715 women in their core study, 65% follow-up at 10 years, and they had a 93% satisfaction rate at 10 years as well. So those were the studies that appeared to support this idea that breast implant illness doesn't really exist, that these types of symptoms that women may be having are likely due to something else, not their breast implants. So what about the other side? So I've taken it upon myself to research some of the studies, a lot of the studies that were cited by these breast implant illness groups. And here are some of the ones I think that are significant. In 1993, the Journal of Autoimmunity looked at 46 women with implants and 45 women without implants. And they found that the women with silicone implants had an increase in antibodies to collagen. In 1997, the Annals of Allergy, Asthma, and Immunology, they looked at 23 women with 26 women without implants, and they found that women with silicone implants had an increased risk of an immune response to collagen. So this is the idea of autoimmune type disease potentially related to silicone breast implants. Well, this is a big deal. 2011, autoimmune syndrome induced by adjuvants. This idea, ASIA, Asia, was created. And this was basically a syndrome that was coined in 2011 that basically describes symptoms caused by a systemic response to adjuvants like silicone. Basically saying that this is a syndrome where people get an autoimmune response to having something foreign in their body like silicone. Is this a better name for breast implant illness? I think so. Now in 2017, there was a study in immunologic research in the journal, and they found that removal of silicone implants improves symptoms in 75%, 469 of 622 women who had symptoms that they believe were due to their silicone breast implants. But only 16% of these women who had true autoimmune disease, they were diagnosed with real autoimmune disease, did their symptoms improve when their silicone breast implants were removed. So basically what that means is that women who had symptoms, like they had fatigue or they had muscle aches or joint aches, 75% of them, when the implants were removed, their symptoms appeared to improve. But if they were diagnosed with a true autoimmune disease, scleroderma, Sjogren's, that type of thing, rheumatoid arthritis, only 16% appeared to significantly improve. In 2018, the International Journal of Epidemiology, they compared 24,561 women with silicone breast implants to 98,000 plus women without silicone breast implants. And they found a small but significant difference in autoimmune and rheumatic disorders in the women with silicone breast implants. And the association was strongest in women with Sjogren's syndrome, systemic sclerosis, and sarcoidosis. Annals of Surgery, this was a big study that made a lot of news recently from MD Anderson. And what this study did was they compiled the US FDA breast implant post-approval studies. It was upwards of almost 100,000 women that they looked at. And they found a higher rate of Sjogren's syndrome, scleroderma, rheumatoid arthritis, and melanoma in women with silicone breast implants than women without. However, interestingly enough, they also found a lower rate of fibromyalgia and lung cancer. Why is that? So this is an interesting study because this is a compilation of individual studies. And so because of that, there is a concern that it may not be quite as powerful as it sounds when you're looking at almost 100,000 women. Interestingly enough as well, the individual studies didn't appear to support this conclusion. It's just when you put all the studies together that it appeared to show this. In 2013, there was a journal from the Netherlands. They looked at 80 women with symptoms and with silicone breast implants. And they found that 75% of them had pre-existent allergies, before this developed, and 69% of them had an improvement in their symptoms with explantation, the implants being removed. In 2015, the Clinics of Rheumatology, they reviewed data linking silicone breast implants to autoimmune disease. And their recommendation was that people who have autoimmune disease or a hyperactive immune system may want to reconsider having silicone breast augmentation. So those are the studies, the prominent ones, and I'm sure there are other ones out there, but these are the ones that I pulled to inform you about. So what have I seen in my own practice, And this is just what I have seen. I have been in private practice in Metro Detroit doing plastic surgery for the last 15 years or so. I've done thousands of breast implant surgeries. This is one of the most common operations that I do. And of these last 15 years, I would estimate, and this isn't inaccurate, I haven't gone and pulled charts or anything, but I've probably seen about 30 to 50 women who've had symptoms that appear to be like breast implant illness. And when these implants were removed from these patients, if they had real autoimmune disease, if they came to see me and they say, Dr. Youn, I've got rheumatoid arthritis, or I've got scleroderma, or I've got Sjogren's, or any of these other things, I've been diagnosed, I've been treated by a rheumatologist, most of them, when we take the implants out, they don't seem to get a whole lot better. Maybe a little bit, but it's not something that is a night and day situation, unfortunately. I'd love to tell you that it is, but it doesn't seem to be that way. However, in those patients who come to see me and they say, hey, I've had silicone breast implants for a few years and geez, I've noticed that my hair is falling out, or I've noticed that I'm getting tired, or I've got body aches, or I've got unexplained rashes, when their implants are removed, I do see a pretty high incidence that their symptoms seem to improve. And so that does seem to match with what I'm reading and I have reviewed for you here in the literature. So what do I believe? Well, I believe that breast implant illness is real. So these stories that you're hearing and that you're reading from women, I believe them. I think that they've got potentially a reaction in their body to their silicone breast implants. And I think a better term for breast implant illness may be ASIA, or this autoimmune syndrome induced by adjuvants. And the adjuvants are basically silicone breast implants. I do believe that breast implant illness is a constellation of symptoms. I don't think that everybody gets the same thing. It doesn't appear to be that way. One patient may have, once again, thinning hair. Another patient may get rashes. Another patient may get some chronic pain. I do believe it's probably more common in women with silicone breast implants than saline, although I don't know of any studies that have really truly separated that out. And it does usually appear several years after the operation. This does not appear to be something that shows up the next day or a week later. I think it's possible that women who have a higher risk of autoimmune, or have a higher risk of breast implant illness if they have autoimmune and allergies. I do believe if I look at the numbers, maybe 1%, maybe a bit more are at risk. I think it's really important to realize that, when you look at the satisfaction rates of silicone breast implants, it is super high. It's in the 90+%. So I don't think that the majority of women get this. It does appear that it's probably a pretty darn small subset, maybe 1%, maybe 3%, we don't know. And it's important to realize, obviously, that more studies need to be done, and to my knowledge, the major plastic surgery organizations are actually doing this now. So doing more studies to determine the risk of breast implant illness, who's at risk, how you treat it, that type of thing, super, super important. And I really want to emphasize that this is not something that happens to everybody. If you're thinking about silicone breast implants, once again, this isn't something that is necessarily going to have to happen to you. So how do you treat BII? Okay, well, if you ask plastic surgeons, their recommendations are really across the board. And we'll get into that in a second. If you ask breast implant illness groups, if you look at what they have online, they recommend either a complete capsulectomy, meaning removal of the implant and the capsule around the implant. The capsule is the scar tissue around the implant. Or they recommend en-bloc removal of the implants in the capsule. And what that means is taking the implant and all the scar tissue around that implant all in one big piece. That's something that I'm not a big fan of, and I'll explain why in just a second. So what do I recommend for my patients? Well, if you're happy with your breast implants, I don't recommend treating it. I mean, if you're happy, you look good, you feel good, why should you really do anything? At this point, just do your mammograms as you need to, as it's recommended by your doctor, do your breast self-exams, and obviously if you think there may be an issue, talk to your doctors. That's what I recommend for my patients. For those patients who are not happy, they don't like their breasts, but they don't have any symptoms, the capsule, the scar tissue isn't thick, so the breast feels fine. Basically a patient who says, look, my breasts look and feel great, I just don't want my implants anymore, then by all means, take them out. Not a big deal, okay? If you want to take them out, then that's your right, and I'm happy to do that for my patients if they don't want their implants. How about if a patient is unhappy with their implants, but they don't have any symptoms, but their implants may be a bit scarred, okay? Their breasts may feel pretty hard, the scar tissue's gotten thick, they don't like their implants. Well, typically most plastic surgeons in this situation would recommend removal of the implants and doing a capsulectomy, removal of that scar tissue, usually most, if not all of it, okay? And then finally, if you're unhappy with your breasts, you don't like how they look, how they feel, and you're having symptoms of BII, then usually what I recommend to my patients is to remove the implants and remove the scar tissue around it if possible. What I don't recommend is having to take every little piece out. If the implant is under the muscles, sometimes there's a back portion of that scar tissue that's really adhered to your ribs. Trying to peel that off could be potentially hazardous and dangerous. So this is what I recommend for my patients right now. Now, what I do not recommend is en-bloc removal of breast implants. Now this is basically a technique where all the scar tissue is removed along with the implant all in one big piece. The problem with this operation is it necessitates a big scar. So today I just removed scar tissue, did a capsulectomy on a patient, and her scar, I did it through an incision about this big, okay? If you do an en bloc, you can't remove a silicone implant through and everything in one piece like this big. Now your scar is going to be like this big. I mean, you have to have it big enough to pull the whole thing out. That is quite deforming. It is quite invasive. And if you have to peel all that scar tissue off the back of the back surface, which is the front part of your ribs, that could be potentially dangerous as well. So until there's any research showing me that en bloc removal of implants is necessary, that people get better symptom reduction, that they heal better, that, you know, once again, their BII is treated better with en bloc removal versus removal in a partial or full capsulectomy, I am not recommending to my patients to do the en bloc removal. I don't know of any studies that show that en bloc removal of implants is a better way to remove implants in patients with BII. And if there is research out there and you're watching this video, comment and give me a link to it because I'm happy to see it. Once again, like I said before, more research is definitely needed. Well, what do I recommend to new patients who want breast implants? Well, I recommend no surgery unless you really want it, okay? So breast implants are not a surgery where, you know, you think about it over a weekend and you say, hey, I'm just gonna go get breast implants. No, breast implants are really a lifelong decision that if you're gonna make for yourself, I really encourage my patients to take the time and to make sure that this is definitely what they want. And I tell my patients, if you're not 100% certain that you want breast implants, hold off, okay? And only do it when you know 100% that this is what you want. I recommend a smooth-walled saline or silicone breast implant. And the reason why a smooth-walled implant is important, in my opinion, and really what we're seeing with the studies is that they appear to have a much, much lower risk, if not almost zero risk, of ALCL. That's cancer. If you're interested in this type of information on ALCL, there is a video here on my YouTube channel where I go over all of that. I recommend that the implant be put through an incision or a scar underneath the breast that has a lower rate of capsular contracture. I don't recommend it be put through the armpit, through an incision around the areola, ideally, or through the belly button. Studies do show that the complication rate appears to be lower when you do it through an incision underneath the breast. I recommend to my patients to go under the muscle when possible with breast implants. Once again, lower risk of capsular contracture. And if my patients have a history of severe allergies or autoimmune disease, then I really want to let them know that is this something that you want to do? Should you reconsider breast implants? How much do you want it when there is a possibility that you may be at a slightly higher risk of BII? And if you do want them, should you choose saline? Okay, and that's something to really take into account when you're thinking about this. So this is the information that I'm giving to my patients now when we're looking at BII. And I think it's super important if you're thinking about breast augmentation to consider all of this information. There's going to be more studies out there. Do your homework. Follow me here on YouTube as well as on our Instagram page where any new research I'll try to put out there so that you know. Thank you so much for watching. My name is Dr. Anthony Youn, America's Holistic Plastic Surgeon, and we will see you soon.